Welcome to Integrity Linguistics Institute. All right, so now I'm going to play the audio. Listen very carefully.
So you've had some changes in your diet. Is anything a problem for you there?
I might be losing a bit of weight because I don't like eating much.
Oh, does that trouble you?
No, I just don't want to eat a lot.
Any trouble with your bowels? I know that you're taking regular laxatives, but is that an issue for you?
Oh, I've had a bit of trouble with constipation over the years. I've taken pills on and off. I've taken something now, actually. But I still feel a bit bloated, a bit crampy.
So it's bothersome?
Yeah, it's not what you'd call slight.
Well, I think we need to have a look at you, maybe make some adjustments to what you're taking, especially since you're getting that bloating.
All right. So that was the audio script. So now let's undergo the same audio script, but in simple. So what is the answer? All right, so I'll do one thing. So it is a slightly tricky question. It is not entirely easy. It is not entirely difficult as well. So what I'm going to do is I'm going to replay the audio just once more. All right. So those who didn't catch it, you can actually listen to the audio just once again. Read about abdominal discomfort. Now let's hear the audio script.
So you've had some changes in your diet. Is anything a problem for you there?
I might be losing a bit of weight because I don't like eating much.
Oh, does that trouble you?
No, I just don't want to eat a lot.
Any trouble with your bowels? I know that you're taking regular laxatives, but is that an issue for you?
Oh, I've had a bit of trouble with constipation over the years. I've taken pills on and off. I've taken something now, actually. But I still feel a bit bloated, a bit crampy.
So it's bothersome?
Yeah, it's not what you'd call slight.
Well, I think we need to have a look at you, maybe make some adjustments to what you're taking, especially since you're getting that bloating.
All right. So that was all right. So now let's discuss the question in a little bit more detail, right? So here, what I'm trying to do is I'm trying to give you the right strategies, right? So when it comes to OET, you need to have skills. So skills are basically your ability, okay? Your ability to perform, right? But basically, what are strategies? Strategies is how you apply those skills. Okay, you see, if you have a lot of strength, but you don't know how to apply that strength to benefit yourself, then it is pointless. So you should have the skills with you, but along with that, you should know exactly how to apply those skills. So that is what we term as strategies. So my duty over here is to not, teach you proper English, that is the vocabulary, because the OET is not and purely a language proficiency test. Okay, so here what I'm trying to do is help you understand like how to grasp a question, how to mentally prepare for a question, and how to approach a question, right? So let's see how to handle this type of a question. So let's read the question first. So here the question is saying, you hear a palliative care nurse. Okay, so it is a care nurse over here talking to an elderly patient. So it's a workplace conversation. It's a consultation between a nurse and an elderly patient. Now, what is your duty over here? Your duty over here is to give importance to what the patient is saying, because they are asking you, what is the patient most concerned about? So here, when you're listening to the audio, you need to focus more on what the patient is saying. See, the nurse is also talking, but the patient is also talking. But the question is asking you to identify the major concern of the patient. So when you're listening to the audio, you must tell yourself, okay, for me, the words that are coming from the patient is what is more important. So you have to give more importance to what the patient is saying, more than the palliative nurse, right? So that is one small strategy. That is, you should know where to invest your focus. All right, you must know where exactly to invest your attention. If you're investing your attention on useless things, then even if you try very hard, it is not going to help you out. Right. Now, what is answer option A? Answer option B and answer option C. All these things are concerns. right? So over here, this is the stem of the question. So this is what we call as the question stem. Okay, question stem basically means the focus of the question. Okay, the focus of the question is basically to identify what is the patient most concerned about. Right. So this is your entire duty over here. And what is answer option A, answer option B, and answer option C? All these things are potential concerns of the patient. Right. So you must be able to make that connection. Right. So now let's take a look into what is answer option A telling. So answer option A is telling a change in her weight. Okay, that is the patient's body weight has actually changed. Maybe it has increased or maybe it has decreased, right? And that is what is concerning the patient over here. Answer option B is telling her new treatment regime. Okay, so here the patient is getting a new treatment. That is, you have to give importance to the present tense. New basically means what? New basically means it is present tense. Old basically means it is going to be past tense, right? So there is a change. Okay, so from her previous medication regime, presently a new medication regime, that is treatment, has been introduced. Okay, that is what we call as a new treatment regime. And this is what is concerning the patient. Answer option C, some abdominal discomfort. So here the patient is having abdominal discomfort, and that is the thing that is the patient most concerned about. Right. Now you see over here, what we just did is something called as keyword analysis, or we can say it as the comprehension of the question. So what we just did is basically comprehension. So step number one is to understand the question. See, if you don't understand the question properly, then no matter how hard you try to listen to the audio, how much ever energy you invest into understanding the audio, if you do not have clear concept of what the question is asking you, it is pointless. So comprehension of the question is extremely important, right? So that is exactly what we did. And how did we do it? So we just did something called as the keyword analysis. All right, now you see over here, what did we do? We basically took a look into the question and we have identified the keywords or the keywords and we have underlined them and circled them. So this is what we call as keyword analysis. So when you're dealing with the question paper with your pencil, you should be able to do the keyword analysis. That is extremely important. Step number two. So once you have comprehended the question, what is the second step? It is retention. Right. So understanding the question is very important. But now what you need to do is you need to register this information to your memory. Okay. You must not forget what the question is asking you. So that is, even with your eyes closed, you should be able to say, I'm listening to a palliative nurse talking to an elderly patient. My duty here is to identify the main concern of the patient. This memory, this information should be very, very thoroughly registered into your mind. This is what we call as retention, right? And with this memory, what you need to do, you have to go and detect the answer, right? And then comes detection. So these are the three steps: comprehension of the question, doing the keyword analysis, registering the information to your memory so that you don't forget the question, and then comes detection, that is finding the correct answer. And when it comes to detecting the correct answer, there is one very important strategy that is called as the elimination strategy. That is, what you're doing is you are not trying to choose the correct answer, but you are trying to eliminate the incorrect answer options. See, just imagine that if you eliminate incorrect answer options, automatically you will be left with one correct answer. So see, sometimes choosing the correct answer is entirely different, is entirely difficult. But if you are able to easily eliminate incorrect answer options, then automatically you have the correct answer option left. Right. So this is what we call as the elimination strategy. All right. So over here, there is a small tip I can give you that is called as the verb analysis. Right. Verb analysis. So verb analysis basically means identifying the action words. Okay, action. Verb basically means actions, right? So there usually, okay, this is not 100%. Okay, this is not 100%, but it is like usually in 75 to 85% of the time, the action words in the answer options are the focus of the answer options. It will be the focal point of the answer options. Okay, just like we have a question stem. Okay, so we have a question stem over here. Similarly, in the answer options also, the question stem, okay, that is the focus of the questions are usually action words, which is basically the verbs. Okay, so if you're able to register the verbs into your mind, then slowly you will be able to improve your elimination strategy. Right. So this is what I'm trying to give you. Okay. Certain tips on this, and you have to slowly, again, don't expect perfection right from the day one itself. Slow and steady only you'll be able to develop these skills. Right. And then you have to maintain that. Now let's take a look into the verbs over here. Right. So let's see what are the verbs in answer option A. So what is the action over here? What is the action word in answer option A? Change. Right? A change in her weight. That is an action, right? It is basically an action over here. So we can say a change in her body weight. This is what is concerning the patient. Okay, this is a keyword. I'm not saying this is not important, but the verb over here is basically the word change. Now let's see what is the focus words in answer option B. Answer option B is her new treatment regime. Okay, so over here, what is the action over here? Treatment. Okay, so we can say new treatment. So treatment is basically that is an action, right? We are giving treatment to a patient. So her new treatment regime, that is what is really scaring the patient, right? So that is what we call as the action word over here. Now, what is the action in answer option C? Some abdominal discomfort. Okay, so being uncomfortable. Okay, it is, we can say it is closely, it is an almost of a verb over here. Someone is uncomfortable, discomfort, and this abdominal. So the stomach is uncomfortable, right? And this is what is concerning the patient the most. Now, see over here, see now you are a little bit lucky we have, because all these answer options are actually small answer options, right? It is not entirely big answer options, it is entirely small. So what happens is, if you perfect the verb analysis, that is if you're able to identify the focal words of the answer options, big sentences will become very small. Now you see, now it is becoming little bit more easier for you. My duty is to identify the main concern of the patient, change in her weight, new treatment, abdominal discomfort. Now you see, it is little bit more easier for you to register this information to your mind. Right. Now, what we have done is comprehension. So we have understood the question. Okay. Now we have registered the information to your mind. Right. Now what you need to do is, when you are going to detect the answer. So now what you're going to do, now you're going to listen to the audio and select the correct answer. Now you should avoid distracting yourself. Okay, remember the OET is trying to distract you. So what should you do? You should not distract yourself. So when you are listening to the audio, okay, after 15 seconds time, when you're listening to the audio, your entire eyesight, okay, your focus should only be in the answer options. Do not look into the question when the audio is playing. Okay, you should not be looking into the question, because when the audio is playing, if you're not looking into the answer options, but if you're reading the question during that time, you are going to be distracting yourself. Okay, you're going to be distracting yourself. So you should not be doing that. Right. So when the audio is going to play, you should have the memory of the question. Palliative nurse, elderly patient, my duty, find the main concern of the patient. And your entire eyesight should only be in the answer options. Do not even look into the question. The memory of the question should be very thorough. Only then you will be able to eliminate the incorrect answer options more easily. Right. So now let's take a look into the audio script over here. Let's take a look into the audio script. So we listen to the audio 2 times. So now what we're going to do is we are going to be reading the audio script. Okay. And then if you want, we have time, we'll be listening to the audio once again. All right. So here, the palliative nurse. Okay. So we are listening to the palliative nurse over here. So let's see what the palliative nurse is saying. So the nurse is asking, so you have had some changes in your diet. Okay. Is anything a problem for you there? So the nurse is asking, I understand that there has been certain changes in your diet. So is there a problem for you there? So here the patient is saying, I might be losing a bit of weight. because I don't like eating too much. Right. Now you see over here, what is the patient in the very beginning saying? The patient is saying, I am starting. I think I'm losing a bit of weight. So what is that? So that is answer option A, right? See, what is the keyword over here? Weight. What is the verb over here? Change, right? So here, what is the in the very beginning itself, what is the patient saying over here? The patient is saying, I might be losing a bit of weight. So now what should you do? Your eyesight. Okay. Now your eyesight should come to answer option A. Okay, so now you should suspect. Okay, so because now you have to put a question mark, maybe if you can move on, because now you're suspecting that it could be answer option because they are talking about weight changes. But what is your duty here? Your duty here is to confirm. Okay, is to confirm whether this is what is concerning the patient most. See, everything is mentioned. Okay, the change is mentioned, weight is mentioned, but it is still suspected because we don't, just because it is mentioned, it does not become the correct answer. We need to understand with 100% confirmation that this is what is concerning the patient most. Okay, so that we have not yet read. Okay, we have not yet listened to it. So here the patient is saying, I might be losing a bit of weight because I don't like eating much. Okay, she doesn't like eating much. Now the person is asking you, does that trouble you? Okay, the person is asking you, okay, is losing weight, is it troubling you? Is it concerning you? And the patient is saying, no. The patient is saying, no, it does not trouble me. No, it does not concern me. So what did you, and she's also saying, I just don't want to eat a lot. She's just saying, okay, I don't want to eat a lot. That is the main reason. I am not really concerned about losing weight. So what just happened over here? What just happened is from suspicion, that is, we suspected that A could be the correct answer, right? Because why? The verb is mentioned and the keyword is also mentioned. But now you are waiting for them to confirm it. But now the person is saying, that is not at all a concern to me. I just don't like eating much. So therefore, I don't mind losing weight. It is not at all a concern. So now what happens is that you can eliminate answer option A. See, that is in the very beginning itself, the very first 2, 3, 5 seconds itself, they are covering this particular concept. And in the very beginning itself, you have eliminated answer option A. So now you have only two answer options. Now you have either it is going to be answer option B or either it is going to be answer option C. So now you have 50-50 chance. See, at least one answer option, if you're eliminating, then you have a 50-50 chance of success rate, right? So now if you want to, if you can do a guesswork, and if you're lucky, you can still choose the correct answer. So that is the benefit of OET. But at least one answer option you should be able to eliminate. That is extremely important. If you're able to eliminate two answer options, fantastic. That means you have already found the answer. Right. So these are the strategies. This is how you have to apply the skills. Okay. So you have a listening skill, you have an understanding skill, but how to apply, that is what as a teacher I'm trying to give you. How to apply those skills into the examination scenario. That is, you're not in a very comfortable environment. You're in a very high stressful environment in the examination hall. So during that time, your brain should work in a very specific manner, right? If you don't have the right tools with you, it is going to be extremely challenging. Right. So now we have eliminated answer option A. Now let's come to the next part of the audio script. So the person is saying, any trouble with your bowels? Okay. So now the person is asking, now what is the keyword over here? Bowels. Bowels basically, so we are all medical professionals. So we know now they are talking about abdomen. Okay. Abdomen discomfort. So now your eyesight. Okay. Now your eyesight should come to answer option C. Okay, that is, it should not go into answer option B because B is new treatment. Here it is abdominal discomfort and we are talking about bowels over here. So from answer option A, your eyesight is now in answer option C. Okay, so now you need to confirm. Now you need to confirm whether C is the correct answer or option or not. So what you can do, you can put a question mark over here. Okay, you suspect, okay, maybe C is the correct answer. Who knows? A is eliminated. So now you're waiting for a confirmation whether C is indeed the right answer or not. So like this, you should be able to eliminate, or not eliminate, but interact with the question paper. Okay, there is no need for you to give a very neat and tidy question paper. You can give a very untidy question paper. It is not at all a problem. Right. So let's take a look into what the person is saying. Any trouble with your bowels? I know that you're taking regular laxatives, but is that an issue for you? Okay, so now they're talking about laxatives. And what is laxative? Laxative is a treatment. Okay, laxative is a treatment. So now, okay, now and little bit of answer option B is also coming. Okay, laxatives. But here, what is the key word over here? New. Okay, new basically means presently, very recently, a new treatment regime has been involved. So here, nothing related to new treatment. Okay, so here they're talking about treatment, but it is not new treatment. So we cannot say it is answer option B. See, when one small tiny word has very, very big importance, right? So they're asking, he's saying, I know that you're taking regular laxatives, but is that an issue for you? So here the patient is saying, again, your answer is coming from the patient, so you must give more importance to what the patient is saying. So the patient is saying, I have had a bit of trouble with constipation over the years. Now, you see over here, the patient is emphasizing. Okay, the patient is emphasizing, I have been experiencing a big trouble. Now, what is the trouble over here? Trouble is a synonym for concern, right? If a person is concerned, if a person is experiencing a trouble, okay, that means they're concerned, right? So, see the emphasis words. Okay, the key words, okay, the synonyms are coming like this. So the person is saying, I have had a bit of trouble with constipation over the years, that is for a very long time. I have taken pills on and off. So this is what? This is past tense, right? Past tense basically means I have taken a lot of pills before, that is on and off. Okay, so again, the treatment is mentioned, but new treatment is not mentioned. See here, this is present tense. Here, the patient is talking about past tense, right? So still answer option B has not yet come, but the more focus is on abdominal discomfort. Okay, I had a bit of trouble with constipation. I've taken pills on and off. I've taken something now actually. Okay, I've taken, that is now basically means the pills. Okay, that is saying I have taken a pill right now. Okay, but is it a new treatment? No, it is not a new treatment. It is the previous treatment, the same pills that she has been taking. So again, it is not a new treatment. And here she's saying, but I still feel a bit bloated and a bit crampy over here. Now you see over here, these are what we call as emphasis words. And see the speaker is emphasizing, I'm having trouble with constipation. Okay, I feel a little bit bloated, I feel a little bit crampy. Right now, are you able to see the link? Okay, trouble, bloated, crampy, constipation, all these things are what? Everything is related to the abdominal discomfort. Okay, so your eyesight is an answer option C. And now when all these things are saying, your suspicion is basically increasing. Now the person is saying, is that bothersome? That is the nurse is asking, okay, so are all these things bothering you? Now the patient is saying yes. Okay, so this is the confirmation. Okay, the person is saying, yes, this is what is bothering me. This is what is the main concern for me. And it is not a slight concern. Slight means mild. So here it is saying, the person is saying it is not slight. Not slight means it is a very big concern for them. Right. So what have you just done? You have basically, first what we did, we eliminated answer option A. Okay, and then what we did, we suspected that answer option C could be the correct answer, and now we have confirmed it. Okay, we have confirmed that it is indeed abdominal discomfort that is the most bothering her, the most troubling thing for her, because the emphasis words, okay, they're repeating the same words, that repetition is coming, the emphasis is coming. Okay, bloated, cramps, okay, and constipation and all that, everything is related to abdominal discomfort. So what is the verb over here? Discomfort. And the keyword over here is abdominal discomfort. So now you have confirmed it. So we can say answer option C is the correct answer. But we have answer option B, right? So see, treatment is mentioned, but you have to wait for new treatment. That is presently a new treatment has been introduced. So is that mentioned anywhere? That is a new treatment being mentioned anywhere? Let's see if that is mentioned. Now you see over here, nothing is mentioned over here. Okay, that is a new treatment the doctor has prescribed a new treatment. That is not at all mentioned. It is old treatment. I have taken pills, past tense. It is not present tense. And now also she has taken the same pills. Nothing new over here, right? So here the patient is confirming, yeah, this is what is bothering me. Now the nurse is saying, well, I think we need to have a look at you, maybe make some adjustments. Okay, especially since you're not getting that bloating. And she's saying that would be good. All right. So now you see over here, before we wind up this particular question, see this word over here, the word but. So what is this? This is what we call as a contrast marker, right? This is what we call as a contrast marker. And what does a contrast marker do? It basically signals a sudden change in idea. Okay, it signals a sudden change in idea. Now see over here, I have taken pills on and off and have taken something now. Okay, so here what is the patient saying? That is, she has taken a pill right now. So when a person is taking pill, why will they take a pill? To get better, right? So we can say this is a positive information. Okay, this is a positive information. That is, the patient is treating herself. She wants to heal herself. So she has taken some medications. Right. Now see over here in the same sentence, the patient is saying a negative information. Now what is the negative information? I still feel a little bit bloated and I feel a little bit crampy over here. And what is that information? That is not positive. That is negative. Right. So that is, as you can see over here, this is what we call as contrast markers. Contrast markers, and the most common word is but. Okay, so but basically it signals a change from positive to negative or negative to positive. Again, this is something you have to like practice it. Okay, you have to repeat the questions repeatedly. Only then you will be able to grasp the main concept. Right. So here we have now confirmed that the answer option to this particular question is indeed answer option C. Right. So this is what you need to do. So choosing the correct answer is fantastic. Very good done. Nicely done. But it should not be out of, luck. It should be basically because you're applying your skills. That is, you're implementing the right strategies and getting the correct answer. So, okay, before we go to the next question, let's just very quickly, redo this one question over here, and then we'll go to the next question, right? So, so this time, just to make it very clear, so we have the record lectures via the app. So the app itself is like, it is a storehouse of knowledge. It took a lot of effort to make these slides. That is available to you 24/7. Use that to your advantage, right? So anyway, let's listen to the audio once again. Now let's hear the audio script.
So you've had some changes in your diet. Is anything a problem for you there?
I might be losing a bit of weight because I don't like eating much.
Oh, does that trouble you?
No, I just don't want to eat a lot.
Any trouble with your bowels? I know that you're taking regular laxatives, but is that an issue for you?
Oh, I've had a bit of trouble with constipation over the years. I've taken pills on and off. I've taken something now, actually. But I still feel a bit bloated, a bit crampy.
So it's bothersome?
Yeah, it's not what you'd call slight.
Well, I think we need to have a look at you, maybe make some adjustments to what you're taking, especially since you're getting that bloating.
All right. So that was, all right. Now see over here, these are the recorded lectures. You will not be getting this anywhere else. The record lectures we can in translations in Indian languages, that is in Malayalam, in like for Hindi, like we have the translations available for each and everything. Along with that, color coded information is there. Explanations are given over here, and also like visuals, like photos, videos, and animations. Everything is given. You have 24/7 access. If you're using it, it is good for you, right? So now let's take a look into the second question that we'll be discussing.
Now I'll hand over to Jenny, who has a few words to say about staffing. Jenny?
Thanks. Now, if we compare ourselves to other hospitals of the same size in other regions, we're actually recording lower rates of staff turnover. That's just as well, given the challenges filling vacant positions across the sector. Where we do compare unfavorably is in the number of days lost to sick leave. That's making it hard to maintain full cover on the wards, and we all know the costs of that. As a matter of urgency, then, HR are looking into the worst affected areas to understand the reasons behind it and to see if there's anything we can do to help and support the staff involved.
Okay. All right. So that is the answer. So listen to the audio just once more. Let's hear the audio script. Once more, listen to the audio.
Now I'll hand over to Jenny, who has a few words to say about staffing. Jenny?
Thanks. Now, if we compare ourselves to other hospitals of the same size in other regions, we're actually recording lower rates of staff turnover. That's just as well, given the challenges filling vacant positions across the sector. Where we do compare unfavorably is in the number of days lost to sick leave. That's making it hard to maintain full cover on the wards, and we all know the costs of that. As a matter of urgency, then, HR are looking into the worst affected areas to understand the reasons behind it and to see if there's anything we can do to help and support the staff involved.
Okay. All right. So that is the. So what could be the answer to the 26th question? So this is a tough question. It's not entirely a very easy one. So it doesn't matter if your answer goes wrong. You can always participate in the chat box. Right? So you can type your answer in the chat box. Let me just take the audio script for this. This is Robert Miller. Yeah. So let's take a look in the 26th question. So I think that this question over here, I guess it was a little bit tougher, right? It was a bit tougher than the previous question. No worries. See, the thing is, you need to understand one very important thing. There are 42 questions, okay? There are 42 questions in your OET. Never expect all the 42 questions of the same difficulty level. Some are easy, some are difficult, some are medium difficulty questions. Okay, and the marking criteria is very complex as well. So it really depends upon what type of question papers you get. Right, so the audio script we have over here. So what are the steps over here? Okay, so what do we do when we are dealing with one question over here? What do we do? Okay, what are the 3 steps? Step number 1 is comprehension, right? So I'll just type it over here once again because it is very important that you understand this concept. Okay, these are the strategies. You have to apply the skills, application. So comprehension you have to apply, and then you have to apply retention, right? And then comes detection. And when it comes to comprehension of the question, what do? You do the keyword analysis. And when it comes to detecting the correct answer, what do? You do the verb analysis. That is, verb analysis basically means giving importance to the action words. All right. And this will help you to eliminate. Okay. This was very, very crucial for bringing in your elimination strategy. Right. So let's do the keyword analysis and let's comprehend the question. You have to thoroughly comprehend the question. So that is why they give you 15 seconds time, 15 seconds to read this tiny portion over here. So let's read the question. Okay. So here they're telling you hear a part of a hospital management meeting where a concern is being discussed. Okay. So a concern is being discussed over here. Okay. And this is from a meeting, a hospital. Oh God. Yeah. Okay. Yeah. So it is coming from a hospital management meeting, right? Where a concern is being discussed. Now, what is your duty? Again, that is a very, very powerful word over here, right? So what is your duty? Your duty is to identify what is the committee concerned. So committee basically means what? That entire group. Okay. So here one person. So one person is going to be representing the committee, right? So for example, in the Olympics, when one participant from India goes to Olympics, what is that person doing? That person is representing India, right? So one person is representing the entire nation. So similarly, one person is representing the entire committee and that person is speaking. So that person is not telling about their concerns. That person is telling about the group's concern. So here, what is the committee concerned about? So that is what your entire focus must be. So what is answer option A, answer option B, and answer option C? They are all concerns of the committee. A, B, and C are all concerns, right? It is as simple as that. Now let's take a look into answer option A. Answer option A, poor response to recruitment drives. Okay, recruitment basically means what? Bringing in, okay, bringing in new people for the jobs. That is what we call as recruitment drives, and very poor response. Okay, that is no one is Yeah, so I'm audible, right? All right. So here, 1 second. Yeah. Okay. So poor response to recruitment drives. That means what? The company over here, the committee over here, they are trying to recruit people, but they are not getting any response. No one is responding to the recruitment drives. Right. Answer option B. Difficulties in retaining suitable staff. Retaining basically means what? Maintaining them. Okay, that is good staff. Good staff basically are the suitable staff, and it is very difficult to keep them there. That is, everyone wants to leave. See, just like everyone wants to leave India and Sri Lanka and go to UK and US and America. Okay, no one wants to stay there. Everyone wants to go. So it is very difficult to retain the staff. That is the concern. Right, you have to understand in this much detail. Answer option C, relatively high staff absence rates. Okay, so over here, what is extremely high? The absence. Okay, the staff are continuously absent, and this is very, very disturbing to the committee. So what we just did is basically keyword analysis. Okay, we have done the keyword analysis over here. All right. So now what we're going to do is identify the verbs over here. Okay. So identify the concern of the committee. So what is the action over here? What is the verb? What words are the action words in answer option A? Poor response to recruitment drive. See, response. Okay. So that is an action. Okay. A very poor response is the action over here. So this is what is the most concerned about. The committee is most concerned about. Very poor response. Answer option B, difficulties in retaining suitable staff. So what is the action over here? Retaining people, right? This is the verb over here. So difficulties in retaining, or we can say retaining. Okay, this keeping the staff with themselves. That is the thing that they're concerned about. Retaining, that is the action word. What is answer option C? Relatively high staff absence rate. So what is the action over here? People are not present. People are basically absent. Okay. So the absence rates, this is what is concerning the persons. Now you see, very, very lengthy sentences. We have made it very, very short. Okay. The concern of the committee is poor response to recruitment drives. The concern is retaining the good staff, and the concern is basically high absence rates. Now, what you need to do, you have to register this information to your mind. Okay. And now your eyesight. Okay. Your eyesight should only be in the answer options. Your eyesight should not be anywhere else. All right. So let's take a look into the transcript over here. All right. So now let's see what the transcript is saying. So here, the hospital manager, now hand over to Jenny. So who's Jenny over here? Jenny is the person who's representing the committee, right? Who has to say few words about staffing. So Jenny is coming. So Jenny is representing the committee and she is telling something. So she's first of all saying thank you. Now, if we compare ourselves to other hospitals of the same size in other regions, we are actually recording lower rates of staff turnover. Okay. So here, what is she saying? She's saying if we compare ourselves to other hospitals of the same size in other regions, okay, the concerning thing is lower rates of staff turnover. That means staff turnover basically means what? Staff are not showing up. Okay. The staffs are not showing up for the work over here. So lower rates of staff turnover, right? So what should you do? Your eyesight should now come to staff absence rates. That is, they are coming to answer option C. So in the very beginning itself, you should know, okay, staff turnover, okay, it is very, very low. And that is what they're beginning with. And that is exactly the keyword over here. So your eyesight, okay, your eyesight must be over here in answer option C. Okay, this is where your entire attention should be, and you suspect that answer option C could be the correct answer. Now, what you need to do is you need to listen to the audio and try to figure out whether that is actually the correct answer option or not. So give me a second. All right. Okay, so now your eyesight is an answer option C. Right. So let's see over here what the person is saying. Again, just because C is mentioned, can we jump and can we choose answer option C? No, because you have to confirm that this is indeed the committee's main concern. Right. So now let's see what the person is saying. That's just as well given the challenges filling vacant positions across the sector. Okay, that's now the person again, they're using very advanced English. They're saying that's just as well given the challenges filling vacant positions across the sector. Now, what are they saying over here? They are also saying there are certain challenges. Okay, there are certain challenges in filling the vacant positions. See, that means what do you understand? That means there are certain positions that are vacant in the hospital. There are certain vacant positions, and filling the vacant positions is concerning. It is very challenging. So now what are they telling? Now it is answer option A, right? So that is from answer option C. Okay, now they're talking about answer option A, because what is answer option C? They're talking about staff absence rates. Now they're talking about poor response to recruitment drives. That means what? Recruitment basically means what? The hospital is having some vacancies. They have certain vacancies and they want to fill in the vacancies, but no one is applying for the jobs. That means it is very challenging. Okay, now see over here, it is very challenging filling the vacant positions. Right. Now, I want you to think very, very clearly. Now, see over here, what part? Now, see this part. See, recruitment drives. Okay, recruitment drives is mentioned, but see over here, poor response. If you think very closely, poor response is not mentioned over here. Okay, that is recruitment drives are happening. Okay, so I'm going to take little bit time to explain this because this concept has to get registered into your mind, right? See, what is recruitment drive? Recruitment drive basically means the people are trying to fill the positions. They have a vacancy and they're trying to fill in the vacancy. That is what we call as recruitment drives. And that is mentioned in the audio script. Right, so that keyword is mentioned. But what is the action over here? What is the verb over here? Poor response. That means no one is applying. That is, no one is applying for the, that is, no one is responding to the recruitment drives. Now, is this mentioned? That means no one or very few people are responding to the job applications. Is anyone, is that mentioned over here? That is not mentioned. Now, you see, this is how cunning the OET is. They will mention one part of the audio, I mean, one part of the, answer option, but they will very, very cleverly, they will not mention one small tiny part of the answer option. And this is why students actually, really struggle with choosing the correct answer because they feel there is more than one correct answer option. So poor response is not mentioned. Okay, see that small attention to detail will definitely help you out. Right. Now see over here, that's just as well given the challenges filling vacant positions. So it is very recruitment drive is happening and is very challenging, but poor response that is not yet mentioned. So we, again, our eyesight is an answer option A, but we only suspect that A could be the correct answer. Right. So A is mentioned, C is mentioned, but A is partly mentioned only. Now here they're telling where we do compare unfavorably. Now see, emphasis. Remember when I told you when a person is concerned, okay, when a person is having a problem, they will emphasize on certain words, right? So what is the emphasis over here? Where we do compare unfavorably is in the number of days lost to sick leave. Okay, so here the hospital is providing sick leave for the staff over here, and the emphasis, okay, so here they are bringing, once again they're repeating the same point, that is they're giving more importance to this, that is so much of days, so many staffs are utilizing the sick leaves and they are losing, okay, see, they are losing so much of days due to sick leave. So now what is your answer option going to, where is your eyesight going to be? Your eyesight from answer option A should once again come to answer option C, right? High staff absence rates. Okay, now see, this is the repetition. Now see, over here they are repeating it once. Okay, so here as you can see, they are repeating lower rates of staff turnover. Right now, once again, they are repeating, that is, they are emphasizing the same message and saying so many days are lost due to sick leave. Right, that's making it hard to maintain full cover on the words. Now see, now they are, extending. Now saying that's making it very, very difficult to maintain full cover on the wards. That is, they have to take care of the patient, the wards, and it is very, very challenging. And we all know the cost of it. Okay, cost basically means what? Cost does not mean money over here. Cost basically means see, expense. Okay, that is, it is not something that that they can afford. Okay, that is, it is not affordable to them. Again, I'm not talking about money, which means it is very important to them. Okay, that means there will be consequences. Cost basically means what? Consequence. Okay, so this is what we call as figurative speech. Okay, so I'm just going into a little bit off topic over here. When it comes to OET, you have to know what are figurative speeches. You have to know little bit about idioms, and you have to know a little bit about metaphors as well. Okay, so over here, figurative speech, idioms, and metaphors, these are not literal meaning. See, cost basically means everyone will think about money, but here that is not the implied meaning. So here the implied meaning is consequence. Okay, that means, see, if no one is taking care of the people in the wards, of course, there will be consequences, right? The patients are going to suffer. That is the consequence. So instead of saying consequence, they are using figurative speech. They're using metaphors and idioms. Okay, so that small practice you have to do. Okay, I'll send you a document that helps you train on these kind of words. Okay, this is how you have to improve your vocabulary. Right. So now let's take a look into the remaining part of the sentence of here as a matter of urgency. Now see, now matter of urgency, the HR are looking into the worst affected areas to understand the reasons behind it and to see if there is anything we can do to help and support the staff involved. Okay, now see over here, the emphasis is once again on the staff. Okay, to help and support the staff. Okay, the reasons behind it. So what is the it referring to? The it is referring to the number of days lost to sick leaves. Okay, so you have to be able to make this kind of connections as well. Okay, so the OET will use preposition articles. So you have to know what is it referring to. Okay, so the reasons behind the sick leave. So the HR is trying to find out why people are taking so much of sick leave. Okay, so the reasons behind the sick leave. So again, the sick leave is what? It is once again related to the staff over here. Now see, the emphasis, the repetition, the more importance is given to low staff turnover. Right. So from answer option A, we have come to answer option C, and we suspected that answer option C could be the correct answer. So from suspicion, now we have confirmed answer option C to be the correct answer. Why is C the correct answer? Because high staff absence rates, it is really, really concerning the committee. Okay, so many of people are taking sick leave. Too much of sick leave is happening. Because of that, no one is taking care of the patients in the wards. Because of that, there is a lot of consequence. And because of that, the HR is now looking into the matter, trying to find the reasons behind the staff absence. This is what the committee is most concerned about. And here, this is mentioned, right? Recruitment drives is mentioned. That is, they have vacancies over there. Okay, they have vacancies, but no one is it is very challenging. It is challenging to fill in the vacancies, but this action, okay, poor response, that is not mentioned. That means no one is interested, no one is responding. That is not mentioned. And because that is not mentioned, we cannot choose answer option A. Now, what is answer option B telling? Retaining the good stuff. Is that mentioned anywhere? Are they telling that everyone wants to leave? No one is interested to stay over here. Are they talking about the retention factor? Nothing. Okay, so here there is nothing they are talking about staff retention. So B is the easiest to eliminate. So like this, if you eliminate A, if you eliminate B, then automatically by default, we will be left with answer option C. Then that will be the right answer. Right, so this is how you have to do. So basically, I do have a document prepared over here that helps you identify the thing a little bit more detail. Okay, so actually for the previous question also, I have prepared a document. Now see over here, the document is telling, okay, this is a main concern. So your duty over here is to identify what is the committee concerned about. Relative high staff absence is the right answer. So what type of question is this? It is a main concern type question, right? So here the focus is on identifying what the committee is the most worried about. As I told you, all three answer options. So here two answer options, it is appearing in some form in the audio. Now the challenge over here is to separate what is the background information and the true problem. So true problem is staff absence rates. The background information is vacancy filling. Okay, so you must be able to separate it. So again, there are certain tips. Wait for signals in the question. Okay, analyze the answer options before you listen. Okay, there are certain keywords. Okay, we talked about keyword analysis. So you have to analyze the answer options like this. Okay, you have to ask yourself the role of questions. You have to notice the contrast markers in the audio, and you have to mentally prepare. That is, after 15 seconds is done, you have to be very much prepared by then to listen to the question. Okay, so here also step 1, 2, 3, 4 and all I have given you, and I have made a list of vocabulary. So here after the class is done, I'll be sending you this this document to you. You can take a look into it. So here also for the previous question also, that is it was a main concern type question, right? So what was the question? Yeah, abdominal discomfort type question. So for that also, I have made a document that gives you certain tips in identifying the question type. Okay, how to mentally prepare yourself for this particular thing. And I have also made a list of vocabulary, that is to help you identify synonym recognition. So I actually slipped my mind to show you this document. Right. So I'll be sending you these documents in the WhatsApp group. So take a look into these WhatsApp, those kind of documents, make some notes. Okay. You have to work a little bit hard over here. Commitment factor is very, very important when it comes to the OET preparation. So we are doing the best we can. I'm giving you the right strategies, but you have to be very patient with yourself. Slow and steady only, all these things will improve. You must never be impatient with yourself. And don't get nervous also. Again, those who are writing the OET exam very soon, understand that the sample questions are very tough. Okay, the sample questions are very, very tough. But on the examination day, you will not find questions to be this tough. Okay, only few questions will be this standard. Most of the questions will be manageable. But the sample questions are always going to be tough. So if at all you find it difficulty, don't allow don't allow that to affect you in a very bad way. Right. So that is what we discussed today. So in today's session, what was the class agenda today? We discussed main concern type questions. Okay. And we discussed how they work. Okay. And I gave you some helpful tips. All right. And that is before listening, what you should do, when you're listening, what you should do, and after listening, what you should do. And we discussed about the other strategies as well. Right. So that marks the end of this session.